While it seems obvious that if you have a rotator cuff tear that you would need surgery to repair it, the research isn't quite as clear. In this video, we'll talk about the research on the effectiveness of surgery for a degenerative rotator cuff tear, and then also some exercise that can be part of a rehab program. Let's start by talking about a 2019 systematic review by the Cochrane Group, which looked at the surgical treatment for rotator cuff tears. And what this study found is that there was uncertain evidence that surgical repair for full thickness rotator cuff tears provides any meaningful benefit when looking at pain, function, or overall treatment success compared to non-operative care. And an interesting note when looking at the re-tear rate after a surgical repair, about 10 to 30% will either have a partial or another full thickness rotator cuff tear. And those individuals don't necessarily have pain. They still have a positive outcome after their surgical repair, which is challenging because it's not quite clear why some individuals with a rotator cuff tear will experience pain while others won't. And it doesn't appear to be related to performance because we see a lot of rotator cuff changes in professional baseball players who actually don't have any pain at all. But what if we don't surgically repair the rotator cuff tear? Won't it just get worse? Well, there was another research article that looked at the outcomes over a 5-year period, and what they found was that those treated surgically had the same outcomes as those electing to do exercise instead. So what rehab exercises can be useful for those with a rotator cuff tear? Well, the rehab program should focus on two different things. One should be on increasing the load tolerance of the shoulder with various movements, and then the other should be restoring pain-free range of motion. To increase the load tolerance of the supraspinatus muscle, which is the more commonly injured rotator cuff muscle, we can use a lateral raise. And depending on what our load tolerance is, we might start off with an isometric exercise because it gives us some more control over the position that we're loading in, as well as how much we're loading the shoulder. And so to perform this, raise the arm up to whatever we're able to tolerate and hold that position for 30 to 45 seconds. If we can perform that, then we can actually go to an isotonic exercise, which just means that we're going to load the shoulder with some movement. So for the lateral raise, raising the arm up slowly to about shoulder height over 3 to 4 seconds, and then slowly back down to that original starting position. For restoring range of motion, we can start off with a quadruped rock, and the goal of this exercise is to slowly rock the hips back, which is going to bring the shoulder into flexion in an overhead position. And so in the beginning, it might be a little bit limited depending on pain, so we might not be able to rock as far back, getting into that full overhead flexion position for the shoulder, but the goal is to gradually build up the tolerance to that position. To increase the load, a modification of the bear crawl can be used, which is really just a progression of the previous exercise. Because our knees are off of the ground, we're putting more load on the upper extremity as we rock our hips back. When we perform this, we want to perform it slowly, and we want to make sure that we're pressing our hands into the ground so that we're not just loading the legs as we shift our hips back. And then finally progressing to a downward dog, which is going to further increase the load on the shoulder, specifically at the end range of flexion. To perform, start in a plank position, and then lift the hips up towards the ceiling, trying to extend through the mid-back, which will help make sure that we're loading at the end range of flexion and that we're getting that full range of motion at the shoulder. If we want to further increase the load, we can elevate the feet on a bench or a chair, which is just going to shift the weight more to the upper extremity. A similar approach can be used for overhead presses. The first exercise would be a wall slide using an exercise band around the wrist. Press the forearms out against the band so that the forearms are parallel, and then slowly slide the arms up overhead as far as you can go. If tolerated from this position, try to lift the arms up off the wall, and then back, and then slowly slide back down to that original starting position. We can then further increase the challenge of this exercise by removing the wall for support and performing a Cuban press. So having an exercise band anchored in front of you, and then pulling to a row, externally rotating, and then pressing slowly up overhead, and then just reversing the motions, so bringing the arms back down towards the side, rotating, and then reversing the press. And then finally increasing the load of the overhead press, starting off with maybe an exercise band or a smaller weight to slowly press up overhead, and then gradually increase the weight to whatever is tolerated. So hopefully these exercises for a degenerative rotator cuff tear were helpful. If they were, don't forget to hit the subscribe button down below. I'll see you in the next video.